Abortion is not constitutionally protected, at least according to the recent court decision in Dobbs v. Jackson's Women's Health Organization. In 2022, the United States Supreme Court overturned Roe v. Wade, a historic ruling that determined women have a constitutionally protected right to abortion. In 1973, the Roe Court argued that actions which are fundamental to the concept of ordered liberty are protected by the 14th Amendment. The Dobbs Court responded, "Abortion is not an action which is fundamental to the concept of ordered liberty. Actions fundamental to ordered liberty might be those which are an expression of autonomous choice, such as who you want to marry or how you spend your money." Roe argues that abortion is among these actions which are fundamental to ordered liberty. Dobbs disagrees. If all expressions of autonomy were fundamental to ordered liberty, then illicit drug use, prostitution, and physician-assisted suicide would all be constitutionally protected rights. Yet, when deciding whether or not physician-assisted suicide was constitutionally protected in Washington versus Glucksberg, the court stated that many of the rights and liberties protected by the Due Process Clause sound in personal autonomy does not warrant the sweeping conclusion that any and all important, intimate, and personal decisions are so protected. Because the court does not protect all autonomous actions, the 14th Amendment does not automatically protect physician-assisted suicide. Since the Liberty Clause of the 14th Amendment does not protect every autonomous action, there must be a strong case to show that abortion is fundamental to the concept of ordered liberty. And the Dobbs Court argues that no such case can be made. The Roe Court appealed to the following cases to argue that the right to abortion is fundamental to the concept of ordered liberty: Pierce v. Society of Sisters, the right to send children to religious schools; Meyer v. Nebraska, right to have children learn German; Skinner v. Oklahoma, the right to not be sterilized; Griswold v. Connecticut, the right to contraception; and Loving v. Virginia, the right to interracial marriage. Yet, as the Dobbs Court points out, none of these decisions have anything to do with the abortion decision. None of these court cases addresses what actions toward unborn humans are legally permissible. When the Roe Court determined that all abortions prior to viability were constitutionally protected, they thereby made a moral judgment about the value of an unborn human life. In other words, they made the claim that the unborn, prior to viability, did not have a right to life. Yet, the moral debate about when or if the fetus has such a right is not for the court to decide by fiat. Sure, the above decisions protect certain autonomous decisions, but as the court has always recognized, an action is not automatically protected by the Constitution just because it is an expression of autonomy. Thus, the Dobbs Court argues, since the rights outlined above are fundamentally different from the abortion decision, there is no constitutionally protected right to abortion. Thank you for watching 5 Minute Ethics. Please like and subscribe.